Okay, so this is the second part for about our discussion regarding gram-positive cocci. So we have here the Streptococci. So under this family, we have which are medically important. We have Streptococcus and Enterococcus, but there are other genus or genera under Streptococci family. So, however, our discussion will focus on the two, Streptococcus and Enterococcus, because as you can see, these are the major cause of human infection or frequent cause of human infections. Okay? Others, hindi na sila ganun ka-frequent. Okay? So, the most medically important are the two, Streptococcus and Enterococcus. Historically, Enterococcus was classified under Group D, Streptococcus. But from previous investigations, it was reclassified into another genera. Thus, we have now the Enterococcus. Okay, so the general characteristic is that same with Staphylococcus, these are gram-positive cocci. The difference is that these are catalase negative. Okay, so we have Micrococcus, Staphylococcus, Streptococcus. The first two are catalase positive, Streptococcus is catalase negative. When it comes to the arrangement, they are more of in pairs or in chains because when it comes to divisions, planar lang yung kanilang division. It's in the side only. Pa-side lang, walang on the up or down or wala sa likod. Walang ganun. Pa-side lang siya. That's why it's a planar division only happens. That's why these are in singly or diplococci or in chains only. Their arrangement under microscope. Enterococci and some streptococci appear more elongated than spherical. In the discussion of Staphylococcus, di ba, these are spherical, so circular, parang perfect circle. But when it comes to Enterococci and some Streptococci, they are a bit elongated. Okay? Medyo may pagkahaba sila. Although hindi sila oblong, medyo lang. Okay? Means they are not circular or these are not perfect circles. Like for example, the Diplococci, Streptococcus pneumoniae. So, this is lancet-shaped Diplococci. Medyo elongated. Okay, hindi siya as in bilog na bilog. These are facultative anaerobes, and colonies are usually small and transparent. Okay, so medyo mas maliliit yung colonies nila if we compare it to Staphylococcus. And there are cases of false positive catalase reaction. Okay, when the colonies are taken from a media containing blood. That's why when you get colonies, you avoid touching or scraping the blood agar because that can lead to a weak catalase reaction that can be interpreted as positive. Okay? Kasi merong peroxidase activity yung blood which would result to bubble formation. Although magiging weak lang yung pattern niya, but that can be read as positive kasi depending on the reader. So, our focus yun nga, Streptococci and Enterococci. Preliminary differentiation will be based on hemolytic pattern. So, we have beta, alpha, and the non-hemolytic or the gamma. So, if we have a beta hemolytic streptococci, there are two major groups. Okay, the GAS, the gas, group A streptococci, and the GBS, the group B streptococci. So, yung group A, group B, C, up to you, that is actually until serologic groups U. Okay? Pero hindi kasi pinatype or we do not classify or um, we do not what you call this one, we do not identify them up to that level yung hanggang U. Okay? So, yung um, yung serologic classification that is by Lancefield classification, it is based on precipitin reaction between a C substance, okay, an antigen that is present in the cell wall of the bacteria. So, it will react with a specific anti-sera. So, if you know the principle behind the blood typing, di ba, you have an anti-sera which will react with the antigen present on the red blood cell. Parang ganun din yung principle ng Lancefield classification, serologic typing. Meron kang anti-sera, parang ganyan, and then that will react to the colonies of bacteria. Okay? So, magkakaroon ng precipitin formation. So, depende kung anong type of polysaccharide ang meron sa cell wall ng bacteria na itetest mo. Okay? So, yan, merong classification A, B, C, D, F, and G. Okay? So, some don't possess a group-specific antigen and can be identified under Lancefield grouping. Examples are si Streptococcus pneumoniae and yung viridans group. Okay, so wala sila nung group-specific antigen na C substance. Okay, present in their cell wall. So, the Lancefield classification are based on their hemolytic pattern and usually sa mga um, beta hemolytic colonies in the SBA yung ginagamitan nito. Serologic grouping or typing of the C carbohydrate polysaccharide. Okay, because they have different types of C carbohydrate polysaccharide, yung different groupings. Okay? So Lancefield typing is used today, yun nga, I already mentioned this one, to distinguish between beta hemolytic strep. So yun na yung main use niya today, to distinguish the beta hemolytic strep. Yung sa Lancefield classification or serological typing kasi, this is rapid and it can be reported immediately. So in the future, DNA probes and hybridization or PCR-related tests will be used to differentiate different species of Streptococci and Enterococci because it's really hard to use the different biochemical tests just to identify them up to the species level. Okay? So yun nga, parang in the future, just in case, it is recommended na yung mga DNA probes and PCR na yung magamit for identification. But since this involves molecular techniques, these are more expensive, way, way more expensive. Okay, so morphology and general characteristic, gram-positive cocci appear in pairs or chains. So we have, that is the usual arrangement for Streptococcus, pairs or in chains. However, for Streptococcus pneumoniae, that is lancet-shaped Diplococcus. So medyo elongated siya and dalawa na magkatabi. So just like this one. Okay, so I hope you can see this well. Diba hindi siya ganun ka-perfectly below and then magkatabi sila. So parang it's a twin. So diplococci. Okay, lancet shape, diplococci. Strep quickly lose the ability to retain the crystal violet, especially at old age. That's why it is recommended to gram stain only yung mga 24-hour cultures, okay, or 24-hour old colonies. Kasi nga, yun nga, as they grow older, okay, this bacteria grow older, they loses their ability to retain the crystal violet. So, they may appear as gram-negative pag older cultures yung ginamit. So, again, because this it appears in pairs and in chains because cell division happens only in one plane. Okay, parang paside lang. Okay? So, we have here in chain, gram-positive cocci in chain. So, that is in chain naman. So, this is gram-positive diplococci. Can we tell based on the gram morphology and the what you call this one, the shape of the bacteria that this is already Streptococcus pneumoniae? Not yet. We have to correlate it and we perform additional biochemical testing for species identification. Although this microscopic examination will give us presumptive identification together with the hemolysis pattern for Streptococcus pneumoniae, which is usually alpha hemolytic. Okay, usually or yes, commonly alpha hemolytic kasi sa Streptococcus pneumoniae. Okay, and pag ganyan yung nakita mo, you cannot report it immediately, but because gram staining, microscopy is not definitive. It is just for presumptive identification. So, Streptococcus family form capsules. Okay, just like the Streptococcus pneumoniae, it form capsules. When it comes also to growth requirements, the Streptococci are more fastigious. It means they have more growth requirement as compared to the Staphylococci. So they require an infusion media or enriched media such as yung blood agar to grow. Okay? So many are hemolytic on blood agar, group A and group B. There are some group C also that are beta hemolytic. And to observe the hemolysis pattern, 5% ship red blood cells is utilized or placed in a nutrient agar. So the type of atmosphere in which the organism is grown may affect the type of hemolysis, lalong-lalo na sa group A, beta hemolytic strep. So if you remember, there are two type of hemolysins. Okay, the two type of hemolysins, the SLO and the streptolysin S. Pag O, okay, yung isa na lang. Kasi ako hindi ko na inaalala yung O. Kapag yung S for stable. Siyempre yung O, that is labile. What do you mean by labile and stable? If the bacteria grows on, like for example, streptolysin. If you grow the bacteria and it produces streptolysin S in the sheep blood agar, and you just place that in the incubator with oxygen, it will show beta hemolytic pattern. Pero kapag streptolysin O lang yung pinoproduce ng bacteria, since that is oxygen labile, hindi siya magkakaroon ng hemolysis pattern dun sa BAP. Nagiget? So, yun, that will affect yung hemolytic pattern dun sa BAP, yung type of hemolysin. Okay? Kasi kumbaga, this hemolysin will it only hemolyzes yung blood cells in the, depending kapag streptolysin S, it will only lyses yung sa red blood cell in the presence of oxygen. Pero kapag streptolysin O lang, tapos na-expose siya sa oxygen, hindi siya magpo-produce ng hemolysis. Okay? Gets nyo yun, ha? So, again, most strains of Streptococci produce both the SLO and the SLS. Okay? However, some Streptococci only produces the streptolysin O, in which it would not be detected if that is grown in the presence of oxygen. So, meaning, kapag streptolysin O lang yung produce niya, hindi magkakaroon ng hemolytic pattern dun sa back. Okay? Unless you stab the primary isolation plate after inoculation, so that may provide a lower oxygen tension necessary to identify those strains that only produce yung streptolysin O. So, medyo i-stab mo daw siya. However, that is not usually performed. Okay? Pero kasi pag mga Streptococcus, for example, possible na Streptococcus yung ma-identify. Usually kasi, if it is a possibility na Streptococcus yung ma-identify, nilalagay kasi yan sa candle jar. Okay, nilalagay sa candle jar. So, there's already a reduced oxygen atmosphere in the candle jar that would then promote hemolysis for Streptococcus, which only produces the streptolysin O. Okay? So, addition of trimethoprim sulfamethoxazole to SBA may be used to suppress the growth of normal flora and allow better recovery of beta hemolytic strep from cultures with a lot of the normal flora like the oropharynx. So, if in case daw na you want a clinician or microbiologist or medical technologist want to recover beta hemolytic streptococci from a clinical sample na normally maraming bacteria na present doon, so pwede siyang gumamit ng maglagay ng additional trimethoprim sulfamethoxazole to SBA to make it more selective. Okay? So, are these Streptococcus, group A Streptococcus considered as normal flora? According to some sources or references, about 5 to 15% of individuals has this as part of their normal flora. Okay? So, Streptococcus or Streptococci are microaerophilic, and for good growth means they require reduced oxygen tension. So, it is recommended or they grow better inside a candle jar as compared when these are just placed inside the incubator. The Streptococcus pneumoniae is sensitive to cold. Okay, that's why for Streptococcus pneumoniae, if this is suspected, these are transported in room temperature. Hindi sila nilalagay or hindi sila nilalagyan ng, what do you call this one, yung parang ice pack. Okay, because they may fail to grow in cultures that have been refrigerated. That's the reason why when plating some of these swabs or especially for respiratory tract specimens, you have to wait lang guys. Okay, so for biochemical identification, again, strep are catalase negative, while staph and micrococci are catalase positive. So for biochemical identification, di ba I mentioned to you that the gram-positive cocci, streptococci, may become gram-negative if you stain old cultures. Okay, so if that's the case, you may or we may confuse this streptococcus with Neisseria. Okay, so if this happens, the oxidase test may verify or may differentiate them. Neisseria are oxidase positive, while Streptococcus are oxidase negative. Okay, so Neisseria oxidase positive, Streptococcus oxidase negative. So if in the identification process you are able to establish that the genus of the bacteria is Streptococcus, you have to consider a lot of things. Okay? So kung Streptococcus siya, you have to consider the following. The source of the specimen. So, saan siya? Sa urine ba? Or pharynx? Sa respiratory tract? Sa blood? Okay, so for alpha hemolytic strep isolated from respiratory tract like a sputum sample, nasopharyngeal swab, yung mga ini-insert dun sa nasal area. So these are likely to be viridan group strep, which are normal flora pag mga alpha hemolytic. Okay? So, pag alpha hemolytic from respiratory tract specimens, pagpipilian mo dyan are viridans or Streptococcus pneumoniae. Okay? Kung alpha, kasi viridans are alpha hemolytic, Streptococcus pneumoniae are also alpha hemolytic. Okay? Another thing to consider, so first, that is yung source of specimen. Okay, kapag alpha hemolytic from respiratory tract, you consider viridans, which are normal flora, and Streptococcus pneumoniae. If that is beta hemolytic naman na strep, okay, pag beta hemolytic na strep, most likely that is group A. Okay, from respiratory tract, sputum, nasopharyngeal swab, mga ganyan na beta hemolytic. So, that is most likely Streptococcus pyogenes. So, that's the correlation. Pero if it comes from genitourinary tract na beta hemolytic strep from genitourinary tract, most likely that is group B, Agalactiae. Okay? So, Agalactiae siya. GBS. Okay? Group B, Streptococcus. Streptococci. Again, pag na-establish mo na Streptococcus, okay, so you check for hemolytic pattern, alpha hemolytic from respiratory tract, viridans or pneumoniae. Beta hemolytic sa respiratory tract specimens coming from respiratory tract, possible group A, Streptococcus pyogenes. Diba? Yung agent ng scarlet fever. For group B naman, kapag beta hemolytic coming from genitourinary tract, most likely that is the Streptococcus agalactiae. Okay? So, differential diagnosis. Okay, pag group A, more commonly associated siya sa signs and symptoms na sore throat. Ang group B naman, associated siya with neonatal meningitis. When we say neonatal meningitis, sa mga newborns. Okay? Pag mga newborns, those are classified as less than 28 days old. Okay? Hemolysis, if the organism is beta hemolytic, i-test mo using the Landsfield classification, using the serologic typing. Okay? Merong A, B, C, D, F, and G. Walang E. So, if you remember the one that I showed you, this one. A, B, C, D, F, and G. Pag beta hemolytic. Okay, where are we na? So, group A, strep pyogenes. So, biochemical differentiation, they are beta hemolytic. Okay? These are also susceptible to 0.04 units ng bacitracin. Gagawin mo lang yung bacitracin test, susceptibility testing, for Streptococcus if that is beta hemolytic. If we try to recall, yung bacitracin is also positive for what? Micrococcus, di ba? Positive din siya for micrococcus. So, susceptible din si micrococcus. So, zone of inhibition greater than 10. So, ganun din si Streptococcus. So, kumbaga, for the Group A, the Streptococcus pyogenes is sensitive. Okay? And even occasionally, yung B, C, G are sensitive. That's why you cannot use yung the bacitracin test to identify as a definitive diagnosis. Okay? Hindi siya pwedeng gamitin for definitive diagnosis. When I say definitive diagnosis kasi, kapag nag-positive siya doon, pwede mo na siyang i-report. Okay? So, resistance to SXT. So, na-discuss naman na natin tong SXT before, mga principle. Both are resistant. Okay? So, both group A, si Pyogenes and Agalaxae is resistant to SXT. Others are sensitive. Kabaliktaran siya ni ano na yung na-discuss natin kanina, bacitracin. For bacitracin, that is sensitive si group A, occasionally B, C, and C, G. Okay? So, yan. SXT, resistant si A and B. PYR, okay? Production of pyroglutamyl aminopeptidase. Both group A and enterococci are positive. So, you can use the PYR test to differentiate between yung beta hemolytic streptococci. Kapag positive siya for PYR, that is group A strep. Kapag negative siya for PYR, pwedeng group B kapag beta hemolytic siya. Okay? So, only group A and enterococci are positive for the PYR test. Others, these are negative. Group B. Si group B naman, biochemical differentiation, of course, hindi natin kakalimutan si CAMP test, Christie Atkins Munch Peterson test, wherein the principle is about yung synergistic action ng 2 hemolysin that gives an arrowhead hemolysis. Okay? So, yung heat stable, so that is hemolysin S. Okay? Or hemolysin S. Extracellular protein that enhances the hemolysis of sheep RBC by the beta hemolysin of the S. aureus. Okay, so this test is positive for group B. The rest, negative na siya. So that is the CAMP test. The CAMP test for the presumptive ID of group B, Streptococci. Okay, so Streptococci agalaxae shows the classic arrowhead near the Staphylococcus string. Hydrolysis of hippurate, group B, okay, are positive. Si group B, enterococci at saka viridans. They are positive. All others are negative. So, si group A, negative siya for hippurate hydrolysis. Growth in 6.5 NaCl, most group B at saka enterococci. The rest, negative. Okay, so you can also use this one to differentiate yung Streptococcus pyogenes from that of Agalaxae. Okay, review tayo ng Agalaxae. Camp positive si Agalaxae. Sa PYR, ano na siya sa PYR? Negative? Yes, negative siya sa PYR. Kasi ang positive for PYR is group A at saka enterococci. Okay? How about sa SXT? That is resistant. Resistant siya sa SXT. Hydrolysis of hipurate, positive. Okay? Hipurate hydrolysis due to the enzyme hipuricase produced by the agalactae. So, growth in 6.5 and ACL also positive. Okay, together with the enterococcus. Si group D biochemical differentiation, si group D kasi pwedeng alpha, beta, or gamma hemolytic pattern. Yung hemolysis pattern niya in the SVAP. So, the group D includes both enterococci and non-enterococci species. So, this is the old one, guys. So, sa group D na kasi, tinanggal na ang enterococci. Ang kasama na sa group D is non-enterococci at saka mga viridans group. Okay, hindi na, iba na yung classification ngayon ng enterococci. Okay, hindi na kasi sila Streptococcus. Bile esculin hydrolysis. So, all group D grow in the presence of bile esculin and are positive for esculin hydrolysis. Okay? So, bile esculin, C, group D, at saka enterococcus lang yung pwede dito sa bile esculin hydrolysis. So, that is the bile esculin hydrolysis. So, yun nga, production ng esculin, turning it to black. So, to differentiate group D enterococci from non-enterococci, that is, utilize yung PYR. PYR test, positive siya for enterococci. Ano pa yung isang positive sa PYR? That is the group A. Okay? Group A, positive for PYR. As well as yung growth in 6.5 and ACL, enterococci lang. So, PYR at saka growth in 6.5 and ACL. So, for enterococci only. Okay? Negative for non-enterococci. Pag alpha hemolysis naman, okay? Alpha hemolysis, optochin sensitivity. Okay? So, optochin susceptibility ang pwede mong gamitin for diagnosis. Okay? So, optochin is a detergent that activates the autolytic enzyme that lyses cell wall ng Strep pneumoniae. Only Strep pneumoniae and the viridans group Streptococcus are, Streptococcus pneumoniae is susceptible. Siya lang yung susceptible for optochin test. Okay? Viridans group, okay, and other strep, so, and others are resistant. So, kumbaga, this is comparison between, kasi diba si viridans and si pneumoniae, pareho silang alpha hemolysis. So, to differentiate them, you may use yung optochin. Pag sensitive, that is pneumoniae. Pag resistant, viridans. So, yan. Susceptibility. So, ano dyan yung susceptible? Yung mas na una. Kasi you can clearly see the zone of inhibition. Streptococcus, bile solubility. So, bile salts also activate the autolytic enzyme of Strep pneumoniae. So, Streptococcus pneumoniae is bile soluble, viridans not. So, optochin sensitive, viridans resistant. Bile soluble, Strep pneumoniae. Negative for bile solubility, viridans strep. Okay? So, the viridans group strep don't contain group-specific C antigen and can't be identified by serologic testing. In one book, I also read na pati si pneumoniae is wala daw siyang C antigen. Most laboratory don't speciate the viridans group strep except for isolates from blood cultures or kapag mga epidemiologic purposes. Other ways to identify streptococci, yun nga yung kanina, which we mentioned a lot of times, yung sa Lancefield typing. Lancefield serological typing based on the C substance or the C antigen present on the cell wall of, what do you call this one, of streptococci. Bakit kaya na-mention na group A, group B? Okay? So, guys, take note ha, yung group A, yung, kumbaga, the most medically important there is the Streptococcus pyogenes. But there are many different serotypes under group A. Madaming bacteria pa yan. Pero ang clinically significant or medically important is si pyogenes. Ganun din sa group B. Maraming serotypes pa yan. Okay? But the medically important is the Agalaxia. So in the Kilang test, so this one, another test to remember for pneumonia. Take note si pneumonia that is capsulated. Kilang test this is used to identify 84 different serotypes of S. pneumoniae. This is based on the differences in the type of specific soluble substances in their capsule. So, ang mangyayari dyan is, in the Kilang reaction, when specific anti-seer against the specific soluble substances bind to the SSS, under the microscope, it appears as the capsule has swelled. So, kumbaga parang lumaki siya. Nagkaroon ng swelling. So, I hope you can see this one clearly. Ito yung sa capsule. So, this is positive for kilang reaction. Okay? So, yan yun. Parang nag-swell na yung kanya capsule. So, that is for Streptococcus pneumoniae. So, we review to differentiate viridans from Streptococcus pneumoniae. That is, we have the optochin test. Sensitive C, pneumoniae. Viridans is negative. Okay? What else? Balikan natin. Yung sa bile solubility, bile soluble C, pneumoniae. Viridans, hindi. Okay? Kilang test, that is for Streptococcus pneumoniae, wherein ang positive result is the swelling of the capsule. Okay, mechanism of pathogenicity for Streptococcus pyogenes. I'm sorry, I was not able to complete na this one, yung mga names. But that should be Streptococcus pyogenes. So, extracellular products. So, yan si streptolysin S and the streptolysin O. So, I already mentioned this one. Okay? But on the lecture part, si streptolysin S is responsible for this. Alter membrane permeability and lyses red blood cells, leukocytes, and other cells containing sterols. Streptolysin O forms membrane-penetrating channels leading to membrane defects and cell lysis. Okay? SLS and SLO. So, in serologic testing, we have this ASOT or the ASO test. Si SLO kasi, si Streptolysin O is immunogenic. Means, it triggers the production of antibody. So, kapag meron siyang SLO or it produces streptolysin O, that can trigger the production of antibodies against the SLO. And this can be identified in the ASO test, anti-streptolysin O test. So, what is this test for? It determines whether an individual has had a recent infection with Streptococcus pyogenes. Kapag dati na siyang may infection. So, yun yung sa ASO test. So, sa SLS naman, streptolysin S. So, that is stable with oxygen. Okay, S for stable. Pero non-immunogenic. Which means it does not trigger the production of antibodies. So, yung SLO, siya lang yung nag-trigger. Kaya antibodies that is produced by the body is directed only to streptolysin O. So, in streptococcal pharyngitis, which is one of the possible disease manifestation of Streptococcus pyogenes, proper sampling is very important. So, in that way, tongue should be depressed. Ito na yung swabbing, nasopharyngeal swabbing. Okay? So, pero sa tongue siya kukuhanin, sa tongue air, through the oral cavity. Hindi sa tongue kukunin, but yung opening should be in the mouth or the oral cavity. And swab rub over the posterior pharynx or sa may tonsillar area. Okay? So, hindi sa nose. Okay? Sa mouth yung opening, in the pharynx or tonsillar area. And yung transport media here is not needed. Okay? Hindi kailangan ng uh, transport media. Okay, so let's continue. So selective media. So SPA containing sulfamethoxazole and colistin and polymyxin B found in formulation ng Streptococcus selective agar ay recommended for better recovery ng mga beta hemolytic from throat cultures. Okay? So, yung plate should be observed after 24 hours in the presence ng beta hemolytic colonies. Pag wala, okay, so continue the incubation after another 1 day. So, bali 48 hours lahat before you report it as negative. Okay? So, if you suspect for beta hemolytic streptococci, yun nga, gumamit ka ng selective media. So for Streptococcus pyogenes, it will appear as small, transparent, and smooth with beta hemolytic pattern. So yung gram stain niya, gram-positive cocci with some short chains. Hindi siya ganun kahahaba. Okay? Pero in chains pa din. So suspect colonies can be lens-filled type using serologic methods which gives a definitive rapid identification. So kapag nakakita ka ng beta hemolytic pattern, gram-positive cocci short chains, and you suspect that this is group A, okay, Streptococcus pyogenes. So you can use the serological testing. So that is definitive. So you can report that immediately. Pag positive siya for the A antigen. Pag positive siya dun sa anti-A, na parang anti-sira. Okay? So pwede mo na yung i-report. That is according to Mihon. Bacitracin susceptibility or PYR hydrolysis. Okay, so it is susceptible and that is positive for PYR hydrolysis. So, whereas other beta hemolytic groups are resistant to bacitracin and they are PYR negative. Okay? Pero kapag ang origin ng isolate is blood or sputum, tapos hindi ka gumamit ng serologic test, you need additional testing to identify. Kapag hindi ka gumamit ng serological testing, ha? Okay, pag nakita mo beta hemolytic siya from blood or sputum, hindi ka gumamit ng Lancefield typing, kailangan mo ng additional test. Heap urate hydrolysis, CAMP test, bile esculin, and growth in 6.5 sodium chloride. Ang positive for CAMP and 6.5 sodium chloride is C group B. So, immunologic test used to detect with infection ng S. pyogenes includes yung ESO, yung ASOT, anti-dinase, anti-streptokinase, and the anti-hyaluronidase. So, we have here yung summary. Streptococcus, pyogenes, and agalactiae, parehong beta. There are also other beta hemolytic species. I want you to memorize this one. I was looking at something kasi parang hindi sila nag-jive dito. Wait lang, asan na yung table? Kasi I mentioned, right, this one, like for example, this one. Yung growth in 6.5 NaCl, I mentioned that group B may also grow here. Pero dito kasi, this is from Mihon, sinabi niya na negative. Okay, however, I also look in some books, yes, nag-grow ang agalactiae, some strings of agalactiae grows in 6.5 NaCl. However kasi, ito is not commonly utilized to differentiate pyogenes at saka agalactiae. Hindi siya yung ginagamit pang differentiate. Usually, ang ginagamit dyan is si, what you call this one, si bacitracin and si camp. Okay? So, I want you to familiarize yourself with this one. Vancomycin, halos lahat sila susceptible. That's why si vancomycin is hindi siya ginagamit sa strep. Hindi kagaya sa staphylococcus. Diba? After penicillin, pag MRSA na, ang recommended na treatment is vancomycin. Dito, hindi siya nire-recommend. Okay? Ang vancomycin. Ay, hindi. Sorry. mali yung interpretation ko. So, pag vancomycin, yes, susceptible silang lahat. So, yes, recommended din ang vancomycin for Streptococcus infection. Okay, bacitracin pala yung nakita ko na. So, for bacitracin, we can use bacitracin to differentiate ito yung pyogenes at saka galaxy. Pag beta hemolytic pattern, pwede mong gamitin si bacitracin. Okay? For optochin naman, ang notable lang dito is pneumonia kasi siya lang yung susceptible for optochin. Hipurate hydrolysis can also be utilized to differentiate pyogenes in Agalaceae, Hipurate positive si Agalaceae, pero PYR positive si pyogenes. P for PYR positive but negative for Hipurate, si Agalaceae positive for Hipurate, CAM positive for group B, okay, leucine aminopeptidase pareho lang sila, and bile esculin parehong negative. So, ang pwedeng gamitin dyan is vancomycin, not vancomycin, bacitracin, hipurate hydrolysis, the PYR test, at saka si CAMP reaction. Okay? Sa Enterococcus naman, to differentiate Enterococcus from group D, is we have there si PYR, at saka sa growth in 6.5 and ACL. Okay? So, according here, si Enterococcus lang yung nag-grow sa 6.5 NaCl. Pero, some strains of Agalaceae are also growing at high sodium or salt concentration. Okay? For viridans versus pneumonia naman, so let's review. Most likely, ang ginagamit to differentiate is the optochin. Kasi pareho silang alpha hemolytic, di ba? Most likely, ang gagamitin dito is si optochin test or the taxopi. Okay? So, the rest, halos pareho na sila. Except for the bacitracin and then si optochin. Pero most likely, optochin yung gagamitin dyan for differentiation. Okay? So, si Esagalaceae, that is invasive disease in newborn. So, neonatal group B, Streptococcus yung GBS. So, colonization of the vagina and rectal area. So, there are two types, early onset at late onset. Pag early onset, in less than 7 days from the birth of the newborn. Pag late onset, that should be greater than 7 days up to 3 months. So, yung manifestation ng early onset, para siyang pneumonia and sepsis. Pero yung late onset na neonatal group B Streptococcus infection is yung manifestation niya is parang meningitis. It mimics meningitis. So, SBAP, it appears as grayish-white mucoid colonies with small zone ng beta hemolysis. Okay? So, pareho silang beta hemolysis. Presumptive ID, positive hipurate hydrolysis, and positive CAM test. So, definitive identification can be made by extracting the group antigen and demonstrating agglutination with specific anti-group B anti-sera. Okay? So, presumptive ID lang yung paggamit ng CAMP and positive hipurate. Pag definitive identification, still preferred ang serological typing kapag magre-react siya with the anti-group B anti-sera. So, according to CLSI, in the detection of GBS in pregnant women, so this is recommended collecting vaginal and rectal material within 35 to 37 weeks ng gestation. So, malapit ng manganak yan. So, the swab should be inoculated in selective broth kagaya ng padhewit containing pwedeng colistin or sinalidixic acid. Another is chromogenic agar that enhances the color of beta hemolysis ng group B, and if present, can be used in place of the SBA. Okay? When performing subcultures from broth or used for their plating. So, cultures are examined when you use chromogenic agar. So, ganun din, examined after 24 hours of incubation at 35 degrees Celsius containing In an incubator, usually sa mga candle jar, kasi nga, they need yung 5% carbon dioxide. Okay, reduced mga micro aerosols sila. They need reduced oxygen concentration. Another selective agar is the strep bicarot broth or SCB. It can be substituted for lim or transvaal broth. So, mga beta hemolytic group B streptococci, kagaya ng agalactiae, produce an orange or red pigment after 6 hours. So, ganun siya kabilis. So, vaginal or rectal swabs are placed in strep bicarot broth. Broth turns orange-red, so that is reported as positive. And no further ID is needed if that's the case. Galing, no? Strep bicarot broth. So, kapag nag-orange siya or nag-red, that is already positive. Okay, orange or red pigment is strep bicarot broth. So, pwede mo na siya agad i-report as group B streptococci. CDC recommends universal vaginal and rectal screening of all pregnant women. So, kapag nag-positive for the group B streptococcus, they should undergo treatment to avoid possible complications kagaya ng neonatal GBS infection. So, si group C and group G streptococci can be divided into large and small colony forms. Si large colony forming beta hemolytic isolates, they belong to this Agalactiae subspecies Equissimus. Pero yung mga small colony forming beta hemolytic isolate ng C and G, these are included sa grupo ng Streptococcus aeruginosus group kasama ng mga viridans. Okay, si Streptococcus pneumoniae, other name, pneumococcus. It can be identified with appropriate anti-sera sa new field test. So, yan yung sa kilang reaction, yung sa swelling ng capsule. You can still remember. New field test. Okay, kilang reaction. So, in the presence of specific anticapsular serum, the capsule swells, known as the kilang reaction. So, from its term alone or from its name, Streptococcus pneumoniae is a common agent for pneumonia, wherein the pneumonia may be complicated by pleural effusion. Okay, so may pleural cavity. The laboratory might receive fluid from pleural aspirate for culture. So, if in the gram staining, it contains many white blood cells and pneumococci, so which is visible in the gram stain, that is a possible presumptive identification. Okay? Mga gram-positive diplococci. So, that is presumptive ID na maraming white blood cells. Pero that is not definitive. Streptococcus pneumoniae may also cause secondary atypical hemolytic uremic syndrome. Atypical hemolytic uremic syndrome sa children. If that's the case, diagnosis is very important. So, blood and CSF culture are usually positive pero negative ay magpo-false positive din yung COMS test. So, that is in secondary atypical hemolytic uremic syndrome. Okay? Blood and CSF are positive and false positive COMS test reaction. I already mentioned this one. Mostly are in pair. So, I also mentioned this one. It doesn't mean that it always appear as lancet shape. Pwedeng minsan singly or short chain. But mostly in pair siya. In diplococci. Okay, so lancet. So, ganun nga. That's why in gram staining, it should be performed from newly grown culture. 24-hour culture. Kasi nag-change siya ng gram reaction. Nutritional requirement ng pneumoniae, it's complex. So, that is considered as fastidious. So, brain heart infusion agar, tetracac soy agar with 5% ship RBCs, or the chocolate agar. So, some isolates require increased carbon dioxide. That's why recommended siya na kapag mga respiratory samples yan, kailangang nakalagay siya sa candle jar. So it produces a large zone of alpha hemolysis in the SPA. Okay? So, balikan natin, how can we differentiate it with viridans? Yung off-the-chain test. Okay? So, off-the-chain, sensitive si pneumonia, si viridans is resistant. Pag mga alpha hemolytic, okay, from respiratory samples. So, we have it here, as you can see. So, if under gram staining, again, you cannot identify. Do not identify it as Streptococcus pneumoniae just because you see a gram-positive nucleococci. You have to do further testing. Okay? One of the characteristic also ng pneumonia is that older colonies may result to autolytic changes. Nagko-collapse yung center ng colony niya. So, parang nagkakabutas. Para siyang may teeth because of the autolytic process that S. pneumoniae undergoes as they grow older. Okay? So, if you can see, there is what you call this one, parang space na hindi siya unstained outside part of the Diplococcus that is actually the capsule. So, yan, yung pitting. Okay. So, kumbaga, nagko-collapse at the colony center because older colonies undergo autolytic changes. So, S. pneumoniae also closely resemble viridans. Okay, so pareho pa sila ng hemolytic pattern. So, yun nga, possible to perform the off-the-chain susceptibility wherein S. pneumoniae is susceptible. Others or viridans are, what do you call this one? Resistant. Pwede din yung bile solubility testing. Bile soluble si S. pneumoniae. Okay? So, bile solubility determines the lysis of S. pneumoniae in the presence of bile salts. Under antimicrobial resistance, S. pneumoniae has become increasingly resistant to penicillin. Okay, so if that's the case, ang next antibiotic that can be utilized are erythromycin and chloramphenicol. Okay, for viridans streptococci naman. So these are normal flora of the upper respiratory tract. Okay, female genital tract and the gastrointestinal tract. Viridans means green, kaya nga alpha hemolytic din sila. However, some are beta hemolytic and others are non-hemolytic. So, as normal with Streptococcus, these are fastigious. They need additional requirement for growth. Okay? So, some strains requiring CO2 for growth. That's why it is recommended that if Streptococcus infection is suspected, yun nga, it should be placed in a candle chart. So, there are 5 groups of viridans streptococci: the metis group, the mutans group, salivarius, bovis, and anginosus group. Okay? So, hindi pwedeng gamitin dito yung Lancefield anti-sera. It has very little value. So, however, for viridans streptococci kasi, most are treated with penicillin. So, hindi mo na siya kailangan i-identify up to the species level. Okay, oropharyngeal commensals that are regarded as opportunistic pathogens. These are most common cause of subacute bacterial endocarditis, bacterial infection, oral infections such as gingivitis and dental caries. So, they are common also in the oral cavity. So, the asanguinosus group are considered normal flora ng GIT. So, they were isolated in bacterium patients associated with invasive pyogenic infection. Si metis group naman, oral cavity, gastrointestinal tract, at saka female genital tract. So, yung mga viridans, so they are normal flora of the, what do you call this one? GIT, genitourinary tract, genital tract, Even si Group B, si Agalactiae, kaya nga pwede siyang mag-cause ng neonatal Group B Streptococcus infection. Si bovis naman, mga blood culture. So, it means it may lead to sepsis, bacteremia, okay, septicemia, and endocarditis. So, the presence of, take note of this one, Streptococcus galolyticus subspecies galolyticus in blood cultures has a high correlation ng gastrointestinal carcinoma. So, let's check. Saang group C? Galolyticus. Sa bovis group. Under bovis group. Yung has high correlation with GIT carcinoma. CS mutants naman are commonly isolated and they are normal flora of the oral cavity. So, they are primary contributors to dental caries. So, they are the most common virulence member associated with bacteremia. Kaya nga, di ba, pag mga oral, yung mga tooth extraction, yung mga tooth surgery, they are given antibiotics to avoid possible infection of the blood or yun nga, or this viridans or the normal floras found in the oral cavity may gain access in the, what do you call this one, in the circulatory system that can lead to sepsis or bacteremia. Okay? So, yun nga, it's extremely difficult to identify up to the species level. So, all members are PYR negative and lab positive. So, lahat daw ng virulence negative for PYR, pero positive sila for leucine aminopeptidase. To differentiate them with the, Streptococcus pneumoniae, you can use the Optochin test. Mostly alpha hemolysis. So, yun nga, Optochin at saka bile solubility. Pareho yan, Optochin test at bile solubility, positive yan for S. pneumoniae. Another is the ability to ferment sugar, VP reaction, the beta-D-glucuronidase activity, and hypergate hydrolysis are used for the differentiation of species within the viridans group. So, si Angionosus, wala siyang Lancefield antigen. Okay? When they are growing pure culture or in high concentration, they may have a characteristic sweet odor, honeysuckle or butterscotch odor. That is for viridans. Galing, no? I don't even know how that odor is. Yung honeysuckle or butterscotch. I'm sorry. Okay? Pero hindi ko din alam. So, Enterococcus and group D Streptococci. So, both are bile esculin positive. Okay? Pero growth in 6.5 NaCl differentiates them. Ang nag-grow sa 6.5 NaCl is si Enterococcus. Sa PYR test, okay, PYR test, ang positive din is si Enterococcus, negative si Group D. So, si Group D is susceptible to penicillin, pero si Enterococcus is usually resistant. So, we have here differentiation. Wait, I'm just looking at this. So, differentiation, pag no hemolysis on blood agar, proceed with bile esculin test. Okay, kasi pwedeng, Enterococcus or Group D, Streptococci. So, perform bile esculin pag positive for bile esculin. Proceed with 6.5 NaCl. So, that can differentiate between Enterococcus at saka Group D. Pero pag negative for bile esculin, mga non-hemolytic Streptococci na yan. Pwedeng mga viridans. Pero pag alpha hemolysis, yun nga, nasabi ko naman na sa inyo, alpha hemolysis, mga Enterococcus, pero most likely, ang differentiation niya para malaman mo agad kung Streptococcus pneumoniae is performed of the changes. Kapag nag-susceptible, okay, that is Streptococcus pneumoniae. Okay? So, pwede din siyang, another test to confirm is yung sa bile solubility. Pag soluble siya So that is Streptococcus pneumoniae. Pero kapag resistant siya sa optochin, so ganun lang din, babalikan mo lang din yung bile esculin test. Pag bile esculin test, pag nag-positive siya sa bile esculin, you perform 6.5 NaCl or PYR. Kapag positive siya doon, that is Enterococcus. Pero pag negative, group D. Negative for bile esculin naman tong si viridans. Okay? Alpha hemolysis, optochin, susceptible, Streptococcus pneumoniae. Pero pag resistant, proceed with bile esculin. Okay, pag positive, proceed with 6.5 NaCl. Pag positive doon, Enterococcus. Pag negative, group D. Pag negative for bile esculin, it means that is viridans streptococci. Okay, so Enterococcus, so yun nga, these are normal flora also of intestinal tract. Commonly identified species, Apicalis and Fishum. Other species, Durans, okay, Caseliflavus, Gallinarium, Raffcosus. So, meron silang D antigen. Kaya nga, before, historically, they were classified as group D, Streptococci. Okay? Pero further identification, tinanggal na sila under group D. So, iba na sila. So, ibang genera na ang Enterococcus. Yun lang kasi meron din sila nung D antigen. Kagaya nung mga group D Streptococci. So, most are non-hemolytic, but others may show alpha or beta. So, yun nga, they may also exhibit pseudo-catalase reaction. So, there is bubble formation after the catalase test, pero very weak lang. So, pag mga ganon is, consider it as negative. Pag weak lang. Kasi if that is really positive for catalase, dapat very prominent yung kanyang reaction. Okay, so they have the ability to grow in extreme conditions. Yun nga, at 6.5 NaCl. They can also grow at 45 degrees Celsius or even in alkaline pH. So, they can grow at extremes and extreme environment. So, ganun po si Enterococci. So, they can also hydrolyze PYR. So, if you remember dito, 6.5 NaCl or PYR. Parehong positive yan for Enterococcus pero negative for group D. So, that is also useful in differentiating them with group D. So, dalawa yung pwede mong gamiting test to differentiate Enterococcus from group D, growth in 6.5 NaCl, and yung PYR test. Parehong positive yun sa Enterococci. So, yan. Ito. NaCl positive. Okay. And PYR positive sa Enterococcus. Enterococcus and group D parehong bile esculin positive. So, specimens should be cultured as soon as possible. Pwedeng gamitan ng trypticase or brain heart infusion. If the medical technology suspect contamination, he or she may use selective media containing bile esculin acid, cholinolidixylic acid, PIA, chromogenic substances, or cephalexin astronam arabinus. So, Enterococcus are identified based on their, first, ability to produce acid. So, they are fermenter. They also hydrolyze arginine. They can grow in the presence of 0.04 telluride. They utilize pyruvate, kaya nga they are PYR positive. They produce acid from methyl alpha D glucopyranoside, and they grow in the presence of 100 microgram erythromycin acid test, and these are motile. Okay? So, yun yung identification characteristics ni, what do you call this one, ni Enterococcus. So, in epidemiologic and investigations of vancomycin-resistant Enterococci, ang ginagamit dyan is molecular typing. Pwedeng pulse field GE, counter-clamp homogeneous electric field electrophoresis, ribotyping, or PCR typing methods. And susceptibility testing, of the enterococcal isolate should be performed only if the isolate is clinically significant. Okay, so that ends the laboratory discussion for Streptococcus. I hope you review well for your exams and quizzes. Thank you so much. So hanggang dyan lang, although there are many other discussion after this, pero these are more of the lecture part. Okay, sa lecture part na yan.